Okay, nurses, nursing students, future NPs, and busy moms, if you've ever been sitting in class, listening to a lecture, reading a textbook, or reading through your patient chart, thinking, what the heck is going on? Can somebody explain this to me in normal words? You're my kind of person, and you're in the right place. Hi, I'm Sabrina. I'm a registered nurse with over 10 years of nursing experience and 20 years of medical experience combined, and I recently became a board-certified nurse practitioner. And probably most importantly around here, I'm a mom. I created this page because there's something you need to know about me. I love explaining complicated things in very simple terms because that's how I learned too. You can give me the long medical definition with all the big words, and yes, we need to know the terminology, but first tell me what's actually happening. Give me the big picture, tell me why it's happening, and then everything else starts connecting. That's how my brain learns best, and over the years, that's become the way I explain things to other people too. It's also how I like to explain things to my patients, because imagine telling a patient your ejection fraction is reduced due to impaired left ventricular systolic function. Okay, but what does that actually mean to the person sitting in front of you? Sometimes I'd rather start by saying your heart is a pump. Right now, that pump is not squeezing as strongly as it should, so it can't push blood forward as effectively. Now we have something we can understand. Then we could build on it. That's how we're going to learn here. Simple first, medical terminology second. Then we connect everything together, because I believe when you truly understand what's happening instead of memorizing words, the information becomes much easier to remember and also to apply. And that's especially important in nursing. I don't want you to just memorize heart failure equals edema. I want you to understand why your patient's having that edema, why they're short of breath, why we're giving that medication, why we're checking these labs, why the providers are ordering these tests, and most importantly, what are you as the nurse supposed to be watching for? Because when all those pieces start connecting, nursing starts to make so much more sense. And that's what we're doing on this page. We're going to break down disease processes like heart failure, diabetes, sepsis, kidney disease, COPD, hypertension, arrhythmias, and more. We're going to talk about labs, medications, fluids and electrolytes, assessments, clinical scenarios, and we're going to take those intimidating medical concepts and break them down into something you could actually picture and understand. Sometimes I may even explain something in a way that sounds almost too simple, and that's intentional. Because once you understand the simple version, then we can add the details. We're also going to be talking about test taking, because nursing exams have a special talent for giving you answers that somehow all look correct. You read the question, you know the material, then you look at the answer and think, well, I would technically do all 4 of these. I know. So we're going to learn how to figure out what the question's actually asking you. We're going to talk about priority questions, safety, ABCs, assessment versus intervention, how to eliminate answers, how to recognize clues hidden inside the question, and one of my personal favorite, how to stop talking yourself out of the correct answer. Because some of us can turn a nursing question into an imaginary patient scenario that was never mentioned in the question. If you're an overthinker, I see you. We're going to work on that. And I don't want you to just watch me for the correct answer. I want you answering them. I'm going to give you clinical scenarios and practice questions. You'll pick the answer before I even tell you mine. Then we're going to break it down together, not just the answer is B. No, I want you to understand, why is B correct? Why isn't A correct? What was wrong with C? And why did D sound so convincing? And what clue in the question should have helped you get there? Because that's how we learn. That's how we learn. And my experienced nurses, you belong here too. We're going to talk about real nursing, not just textbook nursing. We're going to talk about those moments when you're looking at your patient thinking, something just ain't right. Something's changing. I don't know what it is. I don't like it though. We're going to talk about recognizing deterioration in your patients, connecting your labs to your assessment, understanding why certain medications are ordered, organizing your shift, communication with providers, building confidence, and learning how to look at the whole patient instead of just seeing a bunch of random numbers on a screen. Because eventually I want you to be able to look at diagnosis, vitals, labs, medications, assessment findings, and think, oh, okay, I see what's happening here, that moment. That's what I want for you. And if you're thinking about becoming a nurse practitioner, you're definitely going to want to stay, because I went from RN to Family Nurse Practitioner, and we're going to talk about that transition too. NP school, practicums, boards, studying, assessment, differential diagnosis, pharmacology, diagnostics, clinical reasoning, and learning how to transition from thinking like a bedside nurse to thinking like a provider. I'm never going to come here pretending that healthcare professionals know everything. We do not. Medicine is constantly changing, and being a good clinician isn't about knowing every answer off the top of your head. It's about continuing to learn, knowing your resources, recognizing when you don't know something, and caring enough to find out what the right answer is. And then we have mom life, because apparently, after working a 12-hour nursing shift, your children do not care that you've been taking care of patients all day. They still want dinner. Somebody cannot find something that's right in front of them. There's laundry, there's homework, there's that appointment you missed, and somebody's across the house yelling, "Mom," while you're trying to sleep or study. So we're going to talk about that too. We're going to talk about being a nurse and a mom, and or a dad too. Dads belong here as well. Going back to school, advancing your career, working long shifts, studying after your children go to sleep, mom guilt, we all have it, burnout, organization, career changes, confidence, entrepreneurship, and what it's like trying to build something for yourself while you're also responsible for everyone else. Because you can love being a mom and still have goals that belong to you. And I want this page to be a place where we could talk about everything, anything. Some days we'll talk about cardiology. Some days we'll talk about test questions. Some days we'll talk about becoming an NP. And some days we just may need to talk about surviving motherhood after 3 12-hour shifts. And that's okay. Because there's one thing you could always expect from me. I'm going to try and make things very simple. I'm not here to make you feel impressed by how many medical words I know. I'm here to help you understand what those words actually mean. Because if I could explain something complicated in a way that makes you say, wait, that's it, then I did my job. That's the kind of education I want to bring here. I want this to feel like you're sitting next to another nurse saying, okay, girl, I have read this 5 times. Please tell me what this actually means. And I'm saying, come over here, girl. Let me make this make sense. That's our vibe. No judgment, no making people feel inadequate or stupid for asking questions. No pretending that we remember or know everything about nursing. If you don't understand something, just ask. Because I guarantee you, someone somewhere is sitting there wondering the exact same thing. So if you're a nursing student, a new nurse, an experienced nurse, thinking about NP school, already in NP school, a new NP, or you're just another nurse mom trying to balance taking care of your patients and your family and yourself, welcome. You're my people. Now I need you to do something. Follow this page because we're going to learn and grow a lot together. Then go down in the comments and give me one nursing topic that someone has explained to you 100 times and you still don't completely understand it. No judgment. ABGs, heart failure, kidney function, insulin, electrolytes, sepsis, pharmacology, whatever it is, tell me. I'm going to pick topics from your comments and turn them into videos. And if you're a nurse mom, tell me what kind of nurse you are and how many babies you're balancing while doing all this. Because I don't want to just build another nursing account. I want us to build a community, a place where we learn, ask questions, laugh, grow in our careers, talk about motherhood, and remind each other that we don't have to know everything to keep getting better. I'm Sabrina, RN, Family Nurse Practitioner, mom, and apparently your new nursing study friend. So hit follow because we're taking complicated nursing concepts and making them make sense. One simple explanation at a time. And remember, if you don't understand it yet, we just haven't explained it to you in the right way. Okay, girl, come here. Let's make this make sense.